It feels really good. I actually enjoy doing it. I like being in control of my own treatment.
It already gives me hope anyway, so I think that fulfills everything that I want.
Getting our lives back, being able to please ourselves when we come in.
It is scary to start with, but the benefits is unbelievable.
For people with advanced chronic kidney disease, there comes a point when many people need to have dialysis. And dialysis is a complex treatment which takes over the role of the kidney. So shared haemodialysis care is where people on centre-based dialysis in centres such as this are given the opportunity to learn parts of their care. And so the goal was to see whether people could be given the opportunity to learn more about their own treatment and what that would bring, what that would lead to. So the question is, when people come and dialyse in centre, there's a danger that that becomes rather formulaic, rather institutionalised, that the way things are organised encourages a sense of learned helplessness, where we're saying to people, you come in, we'll do the treatment, and then off you go home. And actually that's disempowering, if you like. To an extent, it's disabling.
Well, when I was asked to do shared care, I thought, well, that could be quite interesting. I could learn a bit about my treatment because I didn't know anything in the beginning.
I like to understand what's going on, and I think this helps. I think knowing about the machine, what it does, it empowers you as well. Gives you some self-esteem that you're involved in your own treatment.
I don't think until you're actually involved with a kidney patient that you realise how impactful dialysis is on your life, and that was why we decided that we would do it together, so that it's just as impactful on my life as it is on his.
I think shared care works for a lot of patients because it gives them their independence, it gives them a choice, and it helps them overcome some of the anxieties that comes along with the renal failure.
It builds a strong relationship and knocks down barriers for nurses and patients, and it helps patients feel more comfortable, and it helps the nurse get to know the patient a little bit more.
And with knowledge, the patient are able to understand their treatment better, and they are more likely to be happy and lead a better quality of life.
It's improved my life. 3 years ago, a nurse would take over and do absolutely everything. But now I come straight in and I line my machine, set up my trolley, put my needles in, put myself on the machine and do everything myself, self-sufficient, and it feels really good.
Sitting there worrying like, what is this beeping for? What's that noise? What's this? But then when you go shared care, the worry goes. Because you know what the beeps are and what the noises are and things like that.
The benefits I feel for the patients is that they can do as little or as much as they like. They can take a lot of control or not much. They can work gradually towards a goal and then decide they want to do more. We tailor the programme to their needs.
Right from the outset, we were happy to think about going home. When our consultant mentioned it to us, he said, would you be prepared to go home, because I think you're suitable candidates to go home.
We feel that it's not only going to benefit our social lives in the fact that we're not making dialysis rule our lives, we will be able to dictate when we dialyse.
I've chosen to stay in the unit because it's separate. I think at this stage, if we were to bring it home, there's no getting away from the fact that you're on dialysis. Once I go home, we don't think about it. We just get on with life.
Well, through this programme, this Scaling Up programme, we've involved 19 trusts. So if you imagine, each of those trusts have had quite a significant number of patients. So in terms of patients who've been touched by this programme, it runs into 2,000 or more. And we hope it's going to lead to a cultural change across renal in the UK.
I would say definitely give it a go. I think it makes dialysis a more enjoyable place.
We've been very impressed by the teams that have worked with us, their enthusiasm. We've learned so much from them, and in fact they've had much more to teach us than we've had to teach them, and shared that across the collaborative. So it's basically been the imagination of those teams that have included patients and healthcare professionals. And of course, it's important to acknowledge the Health Foundation who've supported us all the way through.
I've got great pride in my patients. We've worked very hard together, And it's not just the nurse, it's the patient has to put a lot of work and effort into it as well. And coming in now when you watch 4 patients putting themselves onto dialysis or doing some part of their dialysis treatment, is just fantastic.